Well, good afternoon, everyone, and I will now turn it over to Dr. Fitzgerald for our today's update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media briefing yesterday, we've had no new positive cases. The total number of cases in our province remains at 256. That's 238 in the eastern region, 8 in central, 4 in western, and 6 in Labrador-Grenfell. 52% of cases are female and 48% are male. By age, we have 22 people under the age of 20, 37 between 20 and 39, 37 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 5 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 207 people have now recovered, and in total, we have tested 7,134 cases. This week, that should be people, not cases, sorry. This week has proven that our collective efforts can curb the spread of COVID-19 in our province. The dedication you have shown to this is incredible. It has taken great sacrifice and determination, and yet every day you continue to give it your all. And thank you for doing your part and doing it well. As the weekend approaches, please continue to follow the public health measures in place. Stay away from public spaces as much as possible. Practice physical distancing of 6 feet or 2 arms lengths. And wash your hands often and for at least 20 seconds each time, or as long as it takes you to sing happy birthday twice. Stay home if you are unwell and cover your coughs and sneezes. If you are not self-isolating, please take the opportunity this weekend to get out and enjoy some sunshine and fresh air, but do it safely by keeping a physical distance of at least 2 arms lengths from others. These proven prevention measures have long worked in the past and will work now as long as we continue to follow them. Although we are flattening the curve in our province, COVID-19 is and will remain in our communities for the months to come. As we look for ways to relax some of the public health measures in place, it is imperative that we do this in a way that will help prevent surges of new cases. So as we loosen some of these measures, we may at times have to implement new ones. This is not to further restrict our daily lives or how we function in our province, but to protect each of us as we resume a new way of life for now. In this regard, today I'm issuing a new order. Effective Monday, April 27th at noon, employers who bring in workers from out of the country will be required to provide a 14-day isolation plan for those workers upon entering the province. This will help us to detect, trace, and prevent the spread of imported cases of COVID-19 efficiently and effectively. For more information on this order, please visit our website, gov.nl.ca/COVID-19. If we have learned one thing from this pandemic, it is how reliant we are on vaccines to help protect us and keep us safe. COVID-19 gives us a glimpse of what living in a world with a deadly disease that spreads easily and has no vaccine can look like. Work continues across the globe to develop a vaccine for COVID-19, and we eagerly await its arrival, because we cannot consider a return to life as we knew it until then. Therefore, with that in mind, I would like to acknowledge that today marks the beginning of World Immunization Week. This year's theme is Vaccines Work for All, and aims to promote the use of vaccines to protect people of all ages against disease. Immunization saves millions of lives each year and is one of the world's most successful and cost-effective health interventions. It is true when they say an ounce of prevention is worth a pound of cure. As a recap, for those who may have just joined us, we have no new cases since yesterday's media briefing. The total number of cases in the province remains at 256, with 238 cases in Eastern Health, 8 cases in Central Health, 4 in Western Health, and 6 in Labrador-Grenfell Health. Although the road of COVID-19 has not been easy, we are on the right track and we must stay the course. How we move forward depends on each and every one of us. Please continue to do your part by bending the curve and not the rules. I am confident that by working together, we not only have the ability to build healthier and safer communities, but to emerge from this pandemic better, stronger, and more resilient than ever. Thank you.
Well, thank you, Dr. Fitzgerald. Well, we've officially hit 1 full week of 0 positive cases. This is as a result of your diligence, your commitment, your wisdom, and we know that you're following, for most part, following our guidelines. Now, as Dr. Fitzgerald and we've been saying throughout this week, do not let those results change your actions. We cannot stress enough that this does not mean that the virus is not in our communities and moving around us. So we're not out of the woods. We must remain to stay safe. Let's not go looking for loopholes. Just follow the rules. COVID-19 is here. And yesterday, I think that Bill Woolridge in his remarks, said it quite nicely, and as a warning to us, as he said that the virus is not a hoax. It is for real. It can make you very sick and can even threaten your life. So those are the words for someone who has been through this as an individual and has since recovered. And a resident of our province, he spoke with us with a lived experience. I think his words yesterday spoke volumes to many of us, that the virus is indeed an intruder. It invades your body, your life. It affects the life of those around you, and sometimes even threatens your life. So again, I thank you for your efforts and ask that you continue to keep up the great work. Continue to follow the guidelines. For a lot of us, the guidelines are part of our everyday lives now. So let's continue to live like that as it shaped the way we do things or reshaped the way we do things within our province. Before I go any further with my remarks today, I want to let you know that at 2:30 today, that's 2 o'clock in most of Labrador, but 2:30 today in Newfoundland Standard Time, we will be having a moment of silence. And this is, as I mentioned yesterday, this is Wear Red Friday. It was a campaign that's been organized by the National Police Federation. So we're asking all Canadians and the residents of Newfoundland and Labrador to wear something red today to be a symbol of respect for the over 20,000 men and women in the RCMP uniform across our country who are mourning at this time. It's about acknowledging the loss of Constable Heidi Stevenson and the many innocent victims in what has now become Canada's largest mass killing. We have a flag, a Nova Scotia flag, that's flying half-mast on the grounds of the Confederation Building. So we do hope that you will join us as we collectively pay our respects in what is a small but yet a very powerful gesture on behalf of Newfoundlanders and Labradorians to all our friends in Nova Scotia. But before that time comes, I want to tell you about some of the hard work that's happening behind the scenes and some of the additional supports. We appreciate the stress that this global pandemic is having on our business community and our provincial workforce. We have already taken significant steps to improve our ability to deliver programs and services online. There's a site that I want to just bring to your attention. It's called MyGovNL, and it's there that you can manage your personal information. You can renew your driver's license, your vehicle registrations. You can access driving conditions across the province. You can apply for Crown lands. And during this pandemic, as you might expect, there's been a significant jump in the number of people registering at mygov.nl. It's actually up 4 times in the last 5 weeks to what it was the 5 weeks prior to that. So it's definitely a service that's become very handy and where you can actually practice safe physical distancing. So for us, this comes down to making sure that the services that you need, often on a daily basis, is accessible for you. We all know that we're operating very differently and what might look different right now on a daily basis, but we're showing our support for you on a continuing basis for every Newfoundlander and Labradorian, regardless of where you live. Behind the scenes also, we have a team of ministers. We have senior staff that are engaged with many of our business community, engaged with Ottawa, making sure that the tools are in place to overcome the challenges that we are collectively facing. And it's not a small hurdle to actually make such changes swiftly in such a short period of time. But we will continue to work with Ottawa for greater business supports and to fill our local needs. Just recently, or just a few minutes ago, the Prime Minister announced some of the more details around the Canada Emergency Commercial Rental Assistance that was released today. And we'll continue to work and identify other areas to alleviate some of the pressures that businesses are experiencing. It's important for us, too, to make sure that we have a strong business community, because there's many of those businesses that will employ Newfoundlanders and Labradorians as we come out of this health crisis. And I can assure you, as a province, as Newfoundland and Labrador, we will be there to partner with you as we work through this together. As we head into the weekend, as Dr. Fitzgerald has said, on Monday I want to give you an update, and we'll be having Dr. Proton Raman that will be joining us again. And if you remember, he is the clinical scientist at Eastern Health, but also a professor of medicine at Memorial University. And just a few days ago, just before Easter, if you remember, Dr. Raman joined us, and he shared with us some projections and scenarios of what COVID-19 would look like in our province. He's also lead of the core analytics team, and he, as I said, will be joining us again on Monday. Over the weekend, just a reminder that our daily updates will be provided through news release. That will be around 2 o'clock on Saturday, 2 o'clock on Sunday, unless something unforeseen happens. And if that happens, we'll be here on our in those chairs, providing the rationale and the reasons behind that. But if nothing unforeseen happens, it'll be a news release on Saturday and on Sunday. And we will join you back at this table on Monday for what has become our regular daily briefings. Just a reminder as well that you can continue to get your regular updates through COVID-19 website. It's up to date, it's factual, and as Dr. Fitzgerald just mentioned, some of the new orders that we've been putting in place this week, you'll find the details of that on that website. Our website is also a number of supports that where you can get the new federal programs as well. So it's just not the provincial updates, but the federal updates as well. So if you get a few minutes over the weekend, take a look at that website and get the latest information that we have available to you. And I also know that, with a week of zeros, positive cases, many of you are saying, well, come on, let's ease off. Let's, relax some of the measures. So I understand just the discipline and the personal commitment that it takes, can be difficult on some families. But this is an investment in your health. It's an investment in your future. So let's continue to follow those guidelines. Let's continue to work together. We're seeing growing numbers in other provinces. We're seeing growing numbers across the country. And we do not want to be sitting in those chairs on a daily basis announcing extra cases in Newfoundland and Labrador. So let's keep that discipline in place, and those personal sacrifices that you're making, it will be worth it in the end. So let's not forget, too, to take care of yourself. Let's stay in touch, with our friends and our neighbors. I know many of you are feeling a bit stressed and a bit anxious, but I also want to remind you that there are supports available to you. BridgeTheGap.ca is one that we've been talking about on a regular basis, and that's GAP with GAPP. So Bridge the Gap. You'll find the resources both for our adults and for our younger people within our province. And it's really about your mental well-being. So you're not alone. We are there with you, and we have supports available to you. I know as we head into the weekend, too, there's a lot of people within our communities that they find comfort in taking local church services, and I want to thank many of our churches across the province right now that have stepped up in many communities and providing those services online, and we want to recognize and thank you for that. Also, just a reminder to connect with your loved ones either through FaceTime or Skype or just an old-fashioned phone call. It really works to hear a familiar voice and a friendly voice on the end of the line. Also think about the kids that are seeing their grandparents showing up waving and showing posters and signs at your windows and doors and so on. Take some time to sit with your kids. I know it's a little difficult for them to understand, especially your younger children, what's happening in their lives. So online, or do an online play date with their friends. Be a little creative in the things that we can actually do to support them as they try and work and find a rationale of why their lives have changed. We're seeing our adult friends become very creative as well by playing trivia games and so on, listening to music. So there's a lot of great ideas out there, so we can continue to be a little creative. The adversity that we face today will be defined on how we how we respond to it. The impact in some cases, there can change our lives. But I see many opportunities for us as adults as well to come out of this being very creative and even being a more close-knit community. So let's remain positive and be open-minded to some of the new ideas that are existing within our province. Once again, as we head into the weekend, stay safe and stay home. And just a reminder, at 2:30, we will have a moment of silence. I thank you, and I now turn it over to you, Dr. Haggie, for your comments.
Thank you very much, Premier. And again, 0 is a good mark. We're now 14 days out from Good Friday and about 11 days out from Easter Sunday. So again, congratulations to all those Newfoundlanders and Labradorians who took seriously the messages that Dr. Fitzgerald and the three of us were trying to get out. It's obviously paid dividends, and the distancing has been key. I think one of the other themes that the Premier and Dr. Fitzgerald referenced was around accurate information. One of the challenges we've had has been dealing with rumor and allegations. It started with a fake video at the airport, and as recently as this week, involved a non-existent flight of phantom Newfoundlanders who were supposed to be roaming around the town. Whilst it may seem amusing to some and light-hearted, it's had a really corrosive effect on the morale at Eastern Health, the morale of airport employees, and the amount of effort that has gone into pinning down and accurately debunking these rumors has actually been very stressful for all. And I'd like once again to emphasize that from where I sit, the work has gone on day and night to make sure that our borders and boundaries are safe. And I cannot condone any of these kind of things as having any merit or any worth at all. On the subject of misinformation, a little story from the Middle East where a renowned local leader recommended the use of alcohol to prevent COVID-19, and certainly we do recommend alcohol-based sanitizers. But given the culture there, one particular community took to drinking industrial alcohol, and 149 of them are either blind or dead as a result of that misinformation. So when you hear people suggesting drinking bleach to deal with COVID-19, there is absolutely no justification for this at all. It is reprehensible. It beggars belief that anyone would do that. And as a clinician who treated people who survived drinking bleach and spent the rest of their days being fed through tubes, I urge any of you to do what you would do for your children and make sure the stuff under the kitchen sink stays there and not inside of you. So moving ahead, we have been asked, again, to supply some figures. I was asked yesterday about the cumulative hospitalizations across the province rather than our daily bed count. So for the benefit of those who did ask, we've had 22 individuals hospitalized across the province over the course of the pandemic, 4 of whom spent time in intensive care. We currently have 5 in hospital, 2 of whom are in intensive care. So of the 17 discharges from hospital, 14 went home and 3, unfortunately, passed away. And again, we extend our condolences to the family. One of the issues that we have faced has been a very difficult one around funerals and wakes, given the way our pandemic unfolded. And I'd like to draw people's attention to those of you who are struggling with the grief that a passing of any loved one has caused, and particularly with difficulties with closure around our constraints on funeral homes. There is grief counselling available, and a call to 811, and we can direct you to the nearest Doorways clinic, where staff are experienced in coping and helping others cope with grief. And I would encourage you to use that and get some solace and maybe some closure from that kind of discussion. But again, moving ahead, as Dr. Fitzgerald said, in a pre-vaccine world where the virus actually still continues to live with us on a day-by-day basis, is going to be a challenge. the triggers for what comes next in terms of moving towards adaptation will be provided, I think, in some way from Dr. Rahman's discussions and presentations early next week. And once we fulfill those criteria, and given my understanding of the literature elsewhere, we may not be far off that already. Once we are able to pull a trigger, we have to move through a phased plan. That plan, as the Premier has referenced, is in the making. It will be phased, and it will be a whole-of-government approach. Obviously, Dr. Fitzgerald and the medical officers of health in her team and my own department, I would see as key to help advise that. I've likened it in my own mind to an orchestra with each department playing its own bit of the tune, but maybe Dr. Fitzgerald is the conductor of this orchestra. From a health point of view, we have looked at incremental resumption of planned services, surgeries that were put on hold, tests that were deferred, scans that need to be caught up on. And we will have to do this in a measured, phased way also, dealing with the most pressing first and then moving through as the backlog eases to deal with those that kind of waited a little bit longer. We have gone a significant way down the road of reducing our concerns about PPE. They've not gone completely, but thanks to sterling work by the department, and also it's linked with a group called Task Force NL, I think we have shown both a government approach and an entrepreneurial approach. I would just also like to throw a bouquet to a world-renowned hidden gem in some respects in St. John's, which is Verafin, who very recently donated $300,000 to the Healthcare Foundation of St. John's for a specific fund to look at intensive care unit equipment and support for staff. And I'd just like to give them a bouquet. They work quietly in the background and are world leaders in their field of banking security. Another hidden gem and success for Newfoundland and Labrador. From the point of view of what's made a difference, despite advances in science, physical distancing and good old-fashioned public health have been key here. We know about physical distancing. It's obvious that the message has got through. Masks are now recommended when that social distancing may be challenging. I would encourage all of you to keep up the good work that you have done so far. And again, I'll close by my mantra, which is you make a bubble of protection around yourself and your family. You look after that bubble and maintain it, and you don't burst anybody else's. So with those comments, Premier, I would hand it back to you for the rest of the event.
Well, thank you, Minister, for your words today. Now, just a reminder, at 2:30 we will interrupt, as we will take some time for the moment of silence. But before then, we should have, I think, some time for a couple of questions. I'll turn it over to you now, Kathy.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask their questions in the order they registered for today's call. We will run through the telephone queue, and I will call on each reporter by name to ask their question. Please do not press *1 until your name has been called. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. And Peter, please forgive me if I have to interrupt you during your questions. Please go ahead. Peter, if you would press *1. And operator, if you could open that line, please. Okay, let's move on to Patrick Butler of Radio Canada with your questions. Please go ahead.
School board in the province is providing daily face-to-face virtual instruction for students in junior high and high school. Same thing on a slightly smaller scale for primary school students. This is not the case in the English school district, and there's lots of parents who are complaining about not getting a whole lot of guidance from teachers by comparison. Why do we see a difference in terms of the level of instruction happening in the English stream versus the French stream?
Well, so we have two school districts in the province, as you know, the English school district and the French school district. And, from my knowledge and my understanding, the opportunity to actually connect with those in the K-12 system would not be any different. I know the numbers are much smaller. The number of graduates will be much smaller in the K-12 in the French-speaking district. So right now it's, the services, and I know the work that I had done on this would be on the understanding that both school districts would be continue to provide services to the students that they represent and just do so in a new way. It's a different location for the classroom. It would be, as I said a few days ago, in their dining rooms and the teachers would be at a location just not in the classroom, but education would continue.
Given there's been a number of parents who come forward to say that they're looking for more, face-to-face instruction from teachers, are there plans to increase face-to-face instruction, interactions between students and teachers over virtual platforms in the coming days and weeks?
Yeah, so I know there was some challenge. It was not a lot. There was an extensive assessment that was done through the networks to find out how many students that actually could participate virtually, with their teachers. And I know some teachers have done a really good job, and I know students have adapted as well. So right now we'll look for where there's gaps. We want to fill those, but we can also provide the information that would have been required also in hard copies as well for those students who could not receive those. So, our intent is to actually have as many students as possible receive the education materials that they need to be successful till the school year is over. Okay.
Premier, I'll interrupt now as we go into our moment of silence to honor the 22 individuals who lost their lives in last week's tragedy in Nova Scotia. I pass it back to you, Premier.
Okay, thank you. So we will interrupt for the moment of silence, as been just mentioned. So we will now stand in this room to our expression for the moment of silence. So before we go back to questions, I just want to say to all those watching that Newfoundland and Labrador, we stand with Nova Scotia, with our RCMP family and the families that have been experiencing this tragedy in their lives. It's an unimaginable loss and grief. So today, by acknowledging Wear Red Friday, the campaign, as I said, that was organized by the National Police Federation, taking part in this moment of silence is a small gesture as we all mourn together as one nation and as Newfoundland and Labrador to support those that are suffering and impacted by this tragedy in Nova Scotia last weekend. Thank you. So we will
Thank
now.
you, Premier. Patrick, we'll go back to you now for your third question, so please press star 1.
Thank you. I just want to re-ask the question. In the Francophone school district, there are students in upper years that are getting, daily face-to-face video conferencing instruction from students. That's not happening on the English side. Will the amount of will face-to-face interactions be increased for English students in the province?
So for us right now, as a government, we're encouraging the English school system to provide as much support as necessary to those students. I mean, keep in mind, the teachers themselves and the school district themselves, as well as the principals within the school, they're the ones that are responsible for the delivery of education to the K-12 system. So right now, I'd encourage, if there's a student, that feels, or a family that feel that they are not getting the necessary supports, from the school that they would normally get those supports from, will they reach out to the principal and to those that are in those communities that have the direct impact with the students in the K-12 system. So encourage them to reach out to the principals and ask the questions why it is that they're not, if they feel they're not getting the necessary supports.
Thank you.
We'll now go back to Peter Cowan. Operator, Peter tells me that he's not hearing the regular beeping sound he would hear to press star 1 to open his line. So, Peter, you want to try again there now? So press star 1 and please go ahead. Operator, are you able to open his line?
I do apologize. His line is not appearing in the queue. Perhaps, Mr. Cowan, if you could press or lift your handset before pressing star 1. Oh, one moment, please. I will try and open his line manually.
Thank you.
Anyone hear me now?
We sure can.
We got you,
Go
Peter.
ahead, Peter.
Excellent. When people look at the fact that we've had a week with no cases, there are still people who have the disease, but clearly it's not spreading or it's not showing up in the numbers. What's the harm if someone says, you know what, maybe this weekend I'll go visit a friend who I haven't had a chance to see or check in on a family member, because the risk seems to be a lot lower now than it was a couple weeks ago?
So what we have to remember is that this disease does have an incubation period of 14 days, and we know that people can spread the disease before they become really symptomatic. So just before their symptoms develop, or they can have very, very mild symptoms and not really appreciate themselves as being sick and spread the disease. So even though it may appear that there's not a lot of disease circulating in our communities, that's not to say that there's none. So we do have to be careful about that. If you go outside of your bubble, then you may think that you're going into a bubble that has only 1 or 2 people in it, but you don't know exactly how large their bubble is or who they're interacting with as well. So, if they end up being positive for COVID, then, or if they have friends who are positive for COVID, then you've essentially interacted with those people as well. So you're not just interacting with the people that you come into contact with, you're interacting with the people that they've come into contact with. So, you do have to think twice about that. It may seem like it's not a dangerous thing to do or not a risky thing to do, but we don't know that at this time. So the safest bet is still to stay in your bubble, and when you're outside, to practice physical distancing as much as you can. If you can't practice physical distancing, if it's not possible, then you wear a non-medical mask and wash your hands.
Minister Haggie, the former VP of Medicine at Labrador Grenfell Health is going back into service, Dr. John, and he says that anyone going into isolated communities on the North Coast should be tested because there's a bigger concern of what would happen if there's an outbreak that were to happen there. Why aren't we doing that?
We're being guided, Peter, by public health recommendations from PHAC and from Dr. Fitzgerald. At the moment, we have only one project that looks at what's called sentinel surveillance, and that's the individuals coming back from Keel Lake because they have a higher prior predictive probability, in technical terms, of having the disease than any other group we've encountered so far. Should the evidence change, we're quite happy to change as well, but based on public health expertise at the moment, we have the broadest of testing criteria when you compare us with other jurisdictions in Canada.
So, Peter, if I could too, and we all recognize the great work, and I think anyone that is familiar with health services in Labrador would know Dr. John as well, and we're certainly appreciative that he's able to put himself back and re-register and come back to work. He's done a remarkable service to people in Labrador for many, many years. But I also want to remind everyone, too, that going into, especially the north coast of Labrador, there's mechanisms in place and how you get in there. And we are sharing the manifest with local leaders. This came out of a call again, which was reiterated last week. So the number of people that are traveling into those communities that could potentially bring the virus in has been very limited, and traveling is restricted. And we are working with the community leaders to make sure that when people coming in, they are aware of it.
And Premier, I want to follow up on the fire ban because there still seems to be a fair amount of confusion. Your own minister, Lisa Dempster, has told people in Labrador they can continue to go have a boil up in the woods. That's not a problem. So why does the fire ban seem to apply not in Labrador, but it does in Newfoundland?
Well, I think you're right. At this, when this came out, it was announced that people thought that this was something that was relatively new. But indeed, this is the same types of measures that we're putting in place. I've been told for nearly 30 years, and so there needed to be some clarification. Much of that clarification was done yesterday. So we're actually suggesting to people to act responsibly. This is not about having a small fire in your backyard, some evening when the weather's conducive to do so. And so really right now is about being responsible, but there are limitations on what you can actually do with some larger brush fires, grass fires, and so on. And to those involved in the agriculture industry, the permitting, that if you need a permit, you can still do that for those farmers and so on. So it's some clarification that's required, but the department responsible for this, they're putting up those guidelines and will make that information available.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Next week, after we get a bit of update on projections, that we can expect a bit more on a phase plan. Will this look something similar to New Brunswick and Saskatchewan's in terms of like a 5-phase plan?
Well, we looked at
the point of...
Yeah, go ahead. Yeah, okay. So we've looked at the Saskatchewan plan. We'll be, speaking with the Prime Minister tonight or this afternoon and into tonight about what, would happen, federally and nationally as well. So some provinces are at different stages, but it's important for us that we continue to work with the health officials, including people like Dr. Rahman and, of course, our chief medical officers. From there, they provide the guidelines and the evidence, because we could suggest opening up something simply because, some growing need within the community, but yet we need the health advice of where we will be with the projections and make sure that it's safe to do that. So our position has always been, when we open things up, we must continue to be able to do so in a safe manner. In a lot of provinces, they're very general. The plan in Saskatchewan yesterday highlighted and suggested some things that could be done by, early May and mid-May. And so we'll take a look next week what Dr. Rahman says and working with the chief medical officer and see what's safe within our province. And John, I'll pass it back to you to expand on this response.
Thank you very much, Premier. I mean, the idea of phases is crucial, because one of the things that we need to do between phases is to assess the effect. As Dr. Fitzgerald has said, it was a lot easier to lock everything down with a state of emergency than it will be to actually remove it, because there's no playbook for this. So we have to look at our own context and our own way of life. We need to bear that in mind. So from the health point of view, we're going to walk a little bit of a balancing act between how many beds we need to keep free in case of a recurrence of COVID, because it will come, and how many beds we can utilize for planned procedures. And similarly, we need to balance the number of folk coming into healthcare facilities so that we can get some testing done, but we don't jeopardize the real key here, which has been physical distancing. So there will be a step, and then we'll stop and analyze, and then we'll see what happens to the cases. And if we're good, we'll go to the next step. If at some point we find ourselves in a situation where numbers start to creep up, we will have to go backwards. And that's not a failure. That's just a recognition that we went too fast, or we need to think about the wisdom of that step in this order. So again, there's no playbook for this, so it's going to be a slow process. And I think one of the challenges we're all going to have is not to lose our tempers and get frustrated with it.
Sure. Thank you. Looking to this new measure that's going to come into place on April 27th, will employers have to reach out to public health and the government, or how does that work in terms of providing a self-isolation plan?
Yes, so employers will be expected to submit that isolation plan, and that will be communicated with them.
Okay. And hearing from several diabetic patients in terms of foot care, this is something they generally regularly get done, but now not being able to or limited to, any suggestions or advice for them?
That's certainly on our list of things to do, Kelly. We were very pleased to be one of the first to introduce funded foot care for eligible seniors with diabetes. And I think that goes back to some of my own personal interests over the years in reducing risk to seniors. So that's certainly something close to my heart. And we're working now, particularly with, the personal care homes and the long-term care, well, really personal care homes and home support, to make sure it's done in the context of minimizing exposure both to the clients who receive the foot care in terms of the number of people coming to visit them, and also the staff in terms of PPE and such. So that will be part of our phase 3 introduction, and I hope a fairly early one.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. It was announced today that provinces and territories are helping pick up some of the costs associated with providing relief to businesses who are struggling to pay the rent. What kind of impact will this have on Newfoundland and Labrador?
So right now we've identified those within a commercial lease, and there's a number of rules there, and there's a formula that's been applied or that will be applied. So first of all, there's a commercial lease that would be required. It also allows, as you sign and enter into this agreement, that you would not evict the tenant during this period. So it means it's a cost shared. It works with the tenant would have to pay 25%. The commercial leaseholder would have to reduce the amount by 25%, and the remaining 50% would be shared with the province and with the federal government to make up the 100% of the rental requirement for that business. So it's a way to work with primarily small business owners that have been impacted by the tune of a loss of business by 70% within the province. So it's another way we've been able to work together, and we'll get this implemented, and I'm sure along the way here we might see some other gaps that we'll continue to work on as well. But our commitment is to work with the business community. They provide the jobs from the private sector, and this is just another way we've been able to support those.
Thank you. And as well, Premier, today's meeting with the other premiers and Prime Minister has reopening the economy at the top of the agenda. What are your priorities going into that meeting?
Well, I think we've had, looking at and doing analysis of where we are and the success that we've had is you look at Newfoundland and Labrador, and I can truly say when you compare us to other provinces, we've done a very good job, and I give much of the credit to our Chief Medical Officer and the team that she has working with her and the Minister. The small group we have has done a real good job in taking us where we were a few weeks ago to where we are right now. So for me as Premier, the message that I'll be bringing is we must make sure we have very tight border controls. We all know that in the future, if it's probably through a traveler or someone else that will get this into our work sites and into our province, we must also make sure that we have the testing capacity if we need to do more of that in case we have a flare-up, as an example, but also make sure that we have the protective equipment in place. And as the minister has said already about opening up elective surgeries and so on, will require, just by the very nature of this COVID-19 environment, will have a greater demand on protective equipment, as well as you could see some of the private sector have to reach into the pool of protective equipment too for them to safely conduct their businesses. So, these are three components, and there will be others that will be very important to me as we work with our chief medical officer before we reopen. We just want to reopen safely. We'll do it cautiously and making sure that we protect the people from this virus.
Thank you. And lastly, Saskatchewan's debating if it's worth it or not to open schools with what might only be a few weeks left of the school year. But when can people of this province expect a firm decision on whether or not schools will reopen?
Well, I guess you can predict, based on the measures that we've had. We've sent out progress reports now this week for students. We've encouraged and prepared them to finish their school year in the current system that we've put in place. So, for me, I can't say I will meet with the school district, but it would be very unusual, I would suggest right now, that we will actually see students, back in the classroom. But, we'll work with the officials here. But right now, we're seeing some success. I just answered some questions, earlier on this very issue, but we're seeing some success. Students have adjusted, parents have adjusted, teachers have adjusted. That's not necessarily to say that it's all perfect. We've had to make a swift change in recent weeks of our K-12 system, but also the way our post-secondary education has responded as well. So it's unlikely unless there's a drastic change. But for me as Premier, working with the officials, I really can't see getting back into school this year on something unforeseen happens.
Thank you.
Our next questions are from Courtney Zwicker of All Newfoundland and Labrador. Please go ahead. Courtney, if you would please press star 1, we can open your line. Operator, let's move on to Peter Jackson of the Telegram. Please go ahead.
Hello?
Hello,
Peter.
Go ahead.
Oh, thank you. A couple of days ago, Ontario Premier Doug Ford announced extra cash to low-income seniors to help them through the pandemic. What do you say to seniors here, such as one I talked to today, who they're facing extra heating costs, that sort of thing, and they want to know what tangible help can they expect?
Yeah, so from a power point of view, is what we've seen in many other provinces, really been a deferral of utility bills. I know in early April of this year, as part of the GST check, we did have some provincial support that we put in place. It's not a new program, but it's one that has been around for a while. That's been made available. We've, worked, with the federal government to make sure that, the extra money for GST checks and all that's been in the pockets of people within our province. So we'll continue to work, with our local groups, with, seniors in L and many of the resources that we put in place for seniors in our province. We do recognize, that everyone is impacted by COVID-19. And so we want to be there as a province right now to see and explore, what programs we have available. We all know that in our province right now, it's very tight times financially, but, we're not going to, if there's a program that we need to implement to support our seniors, we'll do whatever we can with the resources that we have. For us, the decisions we know have been very difficult, and we recognize that, and especially on seniors and many of our low-income earners in our province, but many of the middle-income earners in our province as well. So there's been a huge impact, and we'll be there to do whatever we can to support those Newfoundlanders and Labradorians, regardless of their age group.
Okay, thank you. This is a question, I guess, for Mr. Haggie. The latest influenza report, which I asked about a few days ago, that it does indicate that the flu cases in hospitals just dropped to the floor pretty well in the second week of April, and that was after a higher than average spike. Has that played a role in plans to restart some elective surgeries?
We actually have been lucky in that regard, that there's a huge overlap between measures you can do to control influenza-like illnesses and COVID-19, because they both share the fact that they are respiratory viruses. I think it's an interesting testament to the efficacy of simple hand hygiene, public health measures such as distancing, and the restrictions that have been put in place through Dr. Fitzgerald's orders. I think we didn't count on getting that. It has made life easier in the sense that it's freed up more beds, and we've used less PPE because, again, ILI, influenza-like illness patients who do require admission use exactly the same sets of PPE pretty well that you would use for COVID-19 patients. So it's been a help. The magnitude of that help will require some further analysis, but it's certainly anything that keeps people healthier and keeps them out of the hospital is great.
Okay, thank you. And I just had a question about blood collection. Obviously those practices have changed, but there isn't any notice on the Eastern Health webpage. There's no answer to major phone line. So how can people know about how to go about getting blood work, or whether they even can?
My understanding is that urgent and emergent blood work can be organized without, reference, as it were, to the RHA. I think I would defer to the RHAs on the specifics of Eastern Health's arrangements. We can certainly put you in contact with someone who could answer that, and if need be, we can disseminate that information more widely if it's an issue across Eastern Health or Metro.
Okay, thank you.
We'll now go back to Courtney from allnewfoundlandlabrador.com. Operator, if you could manually open her line if she's not able to be retrieved by *1.
I'm so sorry. Her line does not seem to be connected at this time.
Okay. Well, we'll take a couple of quick questions from the reporters who are online. So please press *1, and we'll see who we get on the line.
Please go ahead.
Thank you. Wondering about the staff levels for Chancellor Park. We know there's 30 new patients over 3 weeks. Many are concerned about this.
Thank you, Kellyanne. As far as PPE is concerned, we have a link between personal care and long-term care homes directly to the RHA. If there's an issue about PPE, they know who to call. And my understanding is that given some odd hiccups in the supply chain in terms of actually delivery or a box not being packed fully, we have by and large met their needs. Happy to discuss that if that's not the case currently at Chancellor Park. I've not been advised of any issues. We certainly talk about PPE on a daily basis, and we talk about long-term care on a daily basis, and that wasn't flagged this morning by staff in the department as an issue.
Sorry, I was referring to staffing levels.
Okay. The staffing levels at Chancellor Park are organized by Chancellor Park. They are staffed to the same level of accreditation standards that Regional Health Authority facilities are. And again, acknowledging the fact that because there are no support people available to, maybe help with meals or this kind of thing, that the workload is a little bit greater. Again, we've not had any comments from Chancellor Park that they are having challenges meeting the required number of individuals or the required hours of care stipulated in a person's care plan.
Thank you.
We'll take our next question. If you would identify yourself when you start your question, please. Thank you.
Hello?
Yes. Patrick, is it?
Oh, great. I didn't know it was me. Patrick Butler with Radio Canada. I'm just looking for a little clarification on the cumulative total number of hospital admissions. I'm just going to ask you to repeat the number. I was told from the health department on April the 14th, so 10 days ago, that there had been 22 cumulative, or there had been a total of 22 hospital admissions at that point and 5 ICU admissions at that point. Does that mean that those numbers haven't changed in 10 days?
That's correct.
Okay, and does that augur well, I guess? So can you take anything from the fact that nothing has changed in 10 days?
Yeah, I mean, it's another piece of the puzzle, and I think we'll be in a lot better position to put those pieces of a puzzle together when we hear from Dr. Rahman's team about what you could look at in terms of metrics to say we're ready to look at moving into the adaptation phase and moving ahead with maybe opening things up or relaxing some of our restrictions. So, I mean, that certainly is a piece of the puzzle, along with, a week of zero and a period of time that's elapsed since our last kind of riskiest period, which is the Easter weekend. So we're nearly out of the woods from that point of view. So again, it's all part of the trigger piece that Dr. Rahman will perhaps talk about next week.
We have time for one quick question.
Hi, it's Peter at CBC. Not sure if my line's open.
Yeah,
Your
you
line
got
is
it,
open,
Peter.
Peter, go ahead.
Okay. The last modeling that we looked at showed the number of cases increasing, and Minister Haggie, you said you were using those numbers to prepare. Is the fact that the actual number of cases dropped, is that why we were preparing for more cases instead of preparing for what conditions we might reopen?
The modeling, as we said and Dr. Rahman said at the time, was a test in two things. One was it was a test of reading the future, and the second was it's a test of the model. So both of those questions should be answered by the second run that Dr. Rahman and his team have done. So, they will test the validity of their model and see how it fitted with what happened, and then use that to see where we're up to now. It's always very difficult to predict the future. Our crystal ball isn't terribly crystal clear.
Thank you. The time for questions has ended. We will resume our media briefings on Monday, April 27th at 2 p.m., 1:30 in most of Labrador. And please look forward to our news releases on Saturday and Sunday. Have a great evening, everyone.